Assalamualaikum. I'm Dr. Rowshon Ara Begum, Assistant Professor, Department of Forensic Medicine, Bashundhara Ad-din Medical College. Today, I am going to discuss on the topic regional injuries, commonly involving regions of body. Regional injury may be defined as those which comprises injury to various anatomical regions of the body having medico-legal significance. These commonly includes the head region, spine, neck, chest region, abdomen and also bone joint extremities. All of the regional injuries common is the head and neck are most important in forensic aspect because it is the most accessible part of the body as well as the injuries sustained to this part are commonly fatal. Regional injuries are of vital importance in the reconstruction of the events and for further investigation. Head injury. It is defined as a morbid state resulting from gross or subtle structural changes in the skull and or the content of the skull produced by mechanical forces. The application of blunt force to head may result in injury to the content of the skull either alone or with a fracture of the skull. Head injury are commonly correct interpretation of great importance for saving life in living subjects. It is also important for the purpose of accurate reconstruction of the events that sustain the head injury in dead. Head is the target of organ in choice for major assaults. When the victim is knocked or pushed to the ground, he often strikes in his head. The brain and its covering are vulnerable in certain degrees of blunt trauma that would be lethal if applied to the other areas. Injury to the head are very frequent as a result of traffic accidents, assault and fall from height. If the brain is affected, injury may be serious or may be simple. Classification of head injury includes open head injury and closed head injury according to the involvement of the meninges. In case of closed head injury, the dura mater is intact, that is a part of outer meninges, and when the dura mater is torn and easily understanding, it is open head injury. It may also classified in the headings of scalp injury, skull injury and brain injury. Causes of head injuries are common casualties of road traffic accident, assault, fall from height. Cases of head injury should always be x-rayed and observe the victim for at least 24 hours in the hospital. Now, scalp injuries. The anatomical consideration involving 5 layers of the skull from outward to inward. The outer is commonly skin, then connective tissue, aponeurosis that is called gala aponeurosis, loose areolar tissue and finally pericranium that is the periosteum, the surrounding of the bone. Scalp injuries commonly involve abrasion, bruise, laceration, incised wound, incised looking wound, punctured wound, gunshot wound, bone blast wound and finally burn. Vascularity of the scalp and the connection with intracranial vessels results profuse bleeding if it is injured. Bleeding will commonly continue after death if the head is in a dependent position. Scalp is easily injured as it is crushed between the weapon and the underlying skull, that is hard object. Bruise of the scalp is very much detectable by palpation on the side. Laceration will, if inspected carefully, reveals abrasion along with the margins, and examination of the depth of the wound will reveal bridging fibers that will confirm the true nature of these wounds. Tangential forces or glancing blow either from instrument or from a rotating wheel may tear a large flap of scalp tissue exposing the underlying skull that causes avulsion of the skull. Injury to the skull predisposes the victim to intracranial infections when absence of a skull fracture may remain. Meninges may develop by spread infection from a septic scalp wound through diploic or emissary veins. Black eye is a common phenomenon in case of head injury. Bleeding in the soft tissue around the eye owing to blunt trauma of the forehead, rupturing blood vessels and blood tracts along the facial attachment around the lower margin of the orbit, and it commonly termed spectacle hematoma when the blood is collected in the soft tissue around the eye due to fracture of base of the skull, commonly anterior cranial fossa fractures. Better sign is observed when the bruise is over the mastoid press, indicating the fracture of the posterior cranial fossa. Results from extravasation of blood along the path of the posterior auricular artery may be confused with retroauricular scalp injury. This condition is termed as periorbital bruise as well as raccoon eye or supraorbital hematoma. So, the causes are direct violence, injury to the forehead as well as percolation of blood into the orbit from a fracture of anterocranial fossa of the skull. Precautions in case of examination must be taken. First of all, shave the hair area so that the wound will be clearly exposed. Must look for any foreign materials in the wound which may provide the clue about the cause and nature of the wound and also as well as the weapon, such as paint material from a wooden club used to hit on the head. It may be observed by clear examination. Complication can be developed are deeper contusion that take longer time to appear as well as healing. Laceration usually can lead to infection of the suprasagittal sinus through emissary veins. Medical legal importance of head injuries are commonly accidental and homicidal. It may at times scalp injury be a just clue about deep-seated fatal trauma. Also can be helping in establishing the time since injury. Now, skull injuries. Skull injuries is commonly involving the outer and inner layer of the skull, that is the diploic bone having outer tabule and inner tabule. The outer tabule is thicker and stronger than the inner as it is thinner and weaker. The layer of spongy bone is in between this elasticity and the injuries are mainly fracture depending on the violence, site and age of the victim. When the violence is derived by weight or mass and the velocity is according to the equation will be the kinetic energy is mass into square velocity divided by 2. Thus, a small bullet, though a low weight, fire from a firearm is more effective due to its high velocity while moving than a head itself. This violence can be direct as well as indirect. In case of direct violence, the effect can be cranioclast or compression of fetal head during forceps delivery of a baby, crushing of head under wheel of a moving vehicle in case of road traffic accident, a moving object like bullet or a striking stone in the head. Punch-struck syndrome is also observed due to blow of boxers resulting intracranial lesion or even intracranial hemorrhage. Falls from height on the head is also a direct violence effect. In case of indirect violence, force is acting indirectly through some other structures which receive the primary impact, such fall on the buttock produces ring fracture of this occipital bone. Blast explosion of face from below, blows on the chin causes fracture of the base of the skull. Site of the injury of the skull is commonly outer or inner tabule and due to diploic nature of the skull initially outer tabule is bent and with the further increase in force results fracture on the inner tabule first which is weaker and ultimately the outer tabule as well. Common age of the victim involving are infant and children as they are highly vulnerable to this injury, but in case of adult it is less vulnerable. Skull fractures are commonly the injuries occur in the skull, the bony part. It commonly divided into mainly two types, fracture of the vault of the skull and fracture of the base of the skull. The classification of fractures commonly occurring are fissure fracture, depressed fracture, elevated fracture, comminuted fracture, gutter fracture. Others are bone fracture, diastic fracture, perforation, cut fracture and finally stellate or radiating fracture. That's all for today. Assalamu alaikum.